Hi, Dr. Yass here. Today I'm going to be discussing the topic of kyphosis. I was asked to discuss this by an individual named Wendy. One of the great joys I have is when an individual contacts me about a specific issue they're having trouble with and wants clarification both on what is causing the situation and how to resolve it. I've always kind of described myself more as an educator than I am a practitioner. I obviously love the idea of resolving people's pain, but ultimately, the greatest satisfaction I have is when people get to understand what's causing their symptoms and how to resolve it so that they no longer can be manipulated by others who may have some other justification for telling them things that simply are just not factually correct. So this dissertation is for Wendy and anybody else who may be having mid-back pain or finds themselves in this posture and would like to resolve those issues. This will be presented on my YouTube channel. If you like this video, please give it a thumbs up. If you like this video and want to see more of these types of educational presentations, by all means, please subscribe to my YouTube channel, Dr. Mitchell Yass, and that way you'll get notifications when these types of presentations are provided. So today we're talking about kyphosis. Kyphosis basically represents this excessive hunching. So here you can see he has a mild curvature in the thoracic region. So the spine is designed to have a concavity, a curve in at the cervical region, a convexity, a curve out at the thoracic region, and then a mild curve in again, concavity at the lumbar region. So what you see here, this is the fascinating part of this, is that look at, not only do you see an excessive amount of the thoracic curvature, but you see that he's lost a substantial amount of the lumbar curvature. That in fact, he has reversed part of his lumbar spine, which should be curved in, is now curved out. So in a sense, he's increased the level of thoracic curvature. So you can see that what happened here is not only is it just rounding, but now he's picked up some of the lumbar curvature. And as a result of that, he's going to have some problems with mobility, even in the lumbar region, as a result of this. What you'll also notice is this excessive thoracic region curvature causes the head to be brought forward, and even a portion of the cervical spine has now been reversed and is now rounded out. If you notice, this is a curve that runs in all the way down to the top of the shoulder blade. Well, here you can see that even above the shoulder blade, he now has a convexity. This is actually rounded out, and he only has a small amount of the cervical spine that's now concave, right, curved in. So this process of having an excessive level of kyphotic curve actually affects the lumbar and the cervical spine, okay? So these three curves are supposed to work synergistically. When you get some malformation of one, it's going to affect the other two. Okay, so that's what it looks like on the outside. Let's take a look at what it looks like on the inside. So on the inside, what we see here, let me get this more centered for you. So here again, we can see that you have the normal cervical, then the normal thoracic, and you can see right here is where it's starting to curve back. So it's supposed to be 7, 12, 5. Okay, so look what happened here. Excessive curvature. And it goes down much lower. Even this part over here, you can see hasn't begun to curve in yet. It only starts to curve in here. So that's where you can see that part of that lumbar spine has now become, in a sense, almost part of the thoracic spine. And the same thing can be said even here. that way up here, you can see he's only starting to begin to curve in much higher up. So when you're looking at it from the inside, you can see that that excessive thoracic curvature will affect the cervical and lumbar curves. So we can see what's happened here. And the question then becomes, well, what caused this? And you'll probably find that in the medical establishment, they'll say, well, it's part of the aging process. I've heard people say it's from osteoporosis. You can go to a chiropractor or a spinal surgeon, and they'll simply say that this just happens because it happens. And they're going to try to convince you that you need to alter your spine. Now, what you want to say and understand about this is the fact, yes, you do see that the spine has altered, but the spine or the vertebrae themselves do not determine their position. Bones don't determine position. Muscles that attach to bone determine position. Just like your kidney, your liver, your spleen can't move on their own, neither can a vertebrae or any bone. Your shoulder joint can't change its position, your hip joint, your knee joint. Muscles attach to the bones that make up joints, and therefore joint position is based on the pulls of the muscles that attach to those bones. So if you see this happening, the answer isn't, well, the vertebrae have shifted position, therefore I need to shift the vertebrae correctly by some passive mechanism, or God forbid, having a rod put in your spine. This is no different than if we had looked at someone from the side and we saw this side curve of scoliosis, and people are told that they need a rod put in, or that somehow it can be manipulated by a passive attempt to move the bones. You can't move bones and expect them to stay where you move them. Bone position is based on the pulls of muscles, and therefore the only way to alter the location of bones is to alter the pulls of the muscles attached. So when we see this, this is a red flag to some sort of weakness or imbalance of musculature. And the answer is yes, that is what's happening. So now if we can kind of take a look at the muscles of the back, let's take a look at what we see here. So here, this is the trapezius muscle, and this is probably the most significant muscle involved in this situation. So if we look at this grouping here, then we can see that there's an upper trap, a middle trap, and if you look at this gigantic piece here, this is the lower trapezius muscle. The lower trapezius muscle is attached all the way down to the lower cervical spine at the level of the bottom of the rib cage. If you notice, these fibers are vertical, primarily vertical, and therefore, if we looked at the shoulder blade as the mobile portion of the muscle, and this is the stable side, we would say that the lower trapezius can pull the shoulder blade down the back. The lower trapezius can pull the muscle down the back. If we look to this side, we can see that we have the rhomboids, and the rhomboids also attach to the middle thoracic region, attached to the shoulder blade. And if this is the mobile side and this is the stable side, we can say that the rhomboids can also pull the shoulder or the spine back and down. Okay, back and down. So if we want to change the posture, let's go back to this picture. What would be the most easy way of correcting this? Well, if we could attach a string right here and we could pull it back, then you would imagine that this would bring his shoulders back just as it is here, right? This would pull it back and he would lose the excessive kyphosis. But there is no magical string here that you can pull back. So there's only really one alternative that relates to the back and the body, the torso, and that is, what if we were to take the shoulder blades and pull them down? If we were to pull this down, then you would see this come back. And what muscle is in a position to pull down. What did we just talk? Look at the size of this monster. The lower trapezius is in a position to pull down. The rhomboids and mid-traps are in a position to pull down. So therefore, if you want to resolve kyphosis and get the shoulders back, again, we can't pull them back because there's no string, but we can pull the shoulder blade down, which ultimately will pull this back. And I think that's the great misunderstanding and lack of knowledge that most medical practitioners have regarding the issue of kyphosis. The two big issues that must be recognized are, number one, that this altered bone position has not happened by accident, and that these bones just didn't accidentally decide to show up like this or even make a decision to be like this. They were brought this way, right? This is normal posture. This is abnormal posture. Abnormal posture has to be recognized as an indication of a weakness or an imbalance. So once you recognize that altered posture is not structural in nature, meaning that the bones have altered their structure on their own volition, that it's actually a muscular cause, then we can start to look to where the muscular deficit lies. And the muscular deficit lies, when we're talking about excessive kyphosis, in weakness of these two primary muscle groups: the lower trapezius muscle, the rhomboids and mid-traps. Secondarily, we could also look to the posterior deltoid, because if this got stronger, this would pull the shoulder back. And then we could even look into the rotator cuff and even the long head of the tricep, which attaches to the shoulder. So these muscles can affect the shoulder blade, the posterior deltoid, and the long head of the tricep, and the rotator cuff, primarily the infraspinatus and teres minor, can affect the shoulders being pulled back. So if we worked on this entire complex and strengthened it, then that's what you would need to do to change this posture. It is not about osteoporosis. It is not about some voluntary choice of vertebrae to change their position. It is based on a muscular deficit. In this case, specifically weakness of muscles in the back of the shoulder, upper and mid back. Correction of kyphosis can only come by strengthening the lower trap, the mid-trap rhomboids, the posterior delt, the rotator cuff, and the long head of the tricep. This is your solution to kyphosis, excessive kyphosis. Nothing else will correct it. The beautiful part about this is that done correctly with exercises, you can go from this to this in weeks, not years, not months, weeks. But the only way to do that is to understand which the exercises need to be performed and how to perform them correctly. And that primarily can only be achieved by use of the Yass method. If you want to learn more on how to get the Yass method, you can contact me by email at drmitch@mitchellyass.com. Let me just put it down here. I'll even put it down for you. I'm going to write it. And if you want to go to my website and you've decided that this makes sense and you want to schedule a virtual Yass method session, which is beautiful because you don't have to see me in person to go through this process. You can actually do it from the comfort of your home, choosing a time of your choice. You can go to my website, at livewithoutpains.com/sessions. And going there, you can learn more about how the virtual sessions work. And you have the opportunity on a program called Calendly there on that page to be able to schedule your virtual Zoom session. And again, it's beautiful because you can actually get the method virtually. There are testimonials on the page to explain how I've done it with other people. I even explained, there's a video on explaining what you could expect in one of these sessions. They are highly, highly effective. I promise you that you can resolve your kyphosis, which typically leads to mid-back pain. And again, the concept of the mid-back pain, what's causing that mid-back pain, right? Let's put this down. Where are those? There we go. What's causing that mid-back pain? It's not coming from the vertebrae. It's coming from the muscles that attach to the vertebrae. The vertebrae are not eliciting the pain. The muscles that attach. So any attempt to say that this pain is associated with a herniated disc, stenosis, a pinched nerve is a complete fallacy. Complete fallacy. Okay? I want everyone to understand there is a pathway. If you've had kyphosis for a while, if you've had mid-back pain and you're not getting better and you've sought treatment and now you're at the point where people are just trying to manage your symptoms, there's a good reason that you're in that position. And it's because you're being misdiagnosed. It's not that you haven't found the right treatment. It's that you're being misdiagnosed. You have not established what tissue is in distress eliciting your symptoms. In this case of kyphosis and mid-back pain, it is muscle eliciting your symptoms due to weakness and inability to perform your functional tasks. The only way you're ever going to be able to resolve that is through the appropriate strengthening. And again, this is unique to the Yass method. This is not physiotherapy. This is not personal training. There is no chiropractic. There's nothing medical about this. This is a muscular deficit. You're having a fitness-based issue. You are weak in the appropriate muscles that need to be strong to allow you to have normal posture and normal function. All right? So, again, if you want to reach me, let's go back again. If you want to reach me by email, it's drmitch@mitchellyass.com. If you want to learn more about how to get a virtual Yass method session, you can go to livewithoutpains.com/sessions. All right. I hope this helps. I hope, Wendy, if this works for you, maybe just write me back and let me know that this satisfies your concerns and allows you to resolve your deficit. For anybody else, again, by all means, please contact me. I want everyone to be able to be out of pain. There's no reason for anyone to have sustained pain. Absolutely no reason. You establish the cause, resolve the cause. There's no reason for the tissue in distress to elicit that emergency signal of pain any longer. If it's muscular, which I've established in more than 98% of cases, and you've sought care through the medical system, the high probability is you haven't gotten the proper diagnosis. Remember, these muscular causes never will show up on a diagnostic test, and these medical specialties are not educated or trained to identify them. All right? So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.